My name is Müge Mutlu. I have been working in Silivri State Hospital, and I will be talking about the artificial intelligence in child psychiatry diagnosis, treatment, and clinical decision support system. How it provides us benefits, and there is no conflict of interest. So, in the recent years, the requirements have increased recently, and accordingly, it has overcome the traditional capacity. The adolescents who can be treated cannot get the required care, and for that reason, AI is essential and beneficial for the diagnosis as well as providing treatment. And so in the last 3 or 4 years, the machine learning has gained momentum. And in the early time, although there are there is a promise for future, and there are still ongoing studies. Why we talk about AI? Because the neurodevelopmental developments. Distinguished audience, this is English Turkish interpreter speaking. As the speaker is reading out the presentation, I will try my best to catch up with the presentation. I'm sorry for this inconvenience. And the it's a complementary tool. And what is it? AI in child psychiatry. It talks about the computerized systems and also the AI system in psychiatry prefers machine learning, and the patterns and interactions and relations are recognized, and it prefers natural language processing, and accordingly it denotes psychopathologies, and in computer vision, especially the face expressions, the behaviors, and the brain images are analyzed, and accordingly, related to the psychiatric cases, information is provided. And the AI uses such resources, electronic health records, mobile apps, and wearables. And when we talk about wearable technologies, we see that all real-time data are collected through this, and neuroimaging and genetics and standardized clinical instruments, and also related to the genetic dispositions. And in child psychiatry helps for the diagnosis of the autism spectrum disorder, ADHD, and depression, NLP. And autism spectrum disorder starts in social communication deficits and repetitive behaviors. And when the diagnosis takes place after 3 years or after, then it helps. It causes us to lose the opportunities. And also, one of the current studies is about the autism spectrum disorder. In this review on AI in autism spectrum diagnosis, and we see that this sum was achieved up to 98 to 800% accuracy. And of course, there is a few number of studies, and there is also an FDA approved tools. And in this application, first the reports are taken from the parents, and then the patients fill out a structured survey, and also the symptoms related to obsessive compulsive disorder are targeted, and also two videos are asked from the parents about the related to the child, while the child is, for example, playing games and also playing with the friends, for example. And most of the time, the pediatrician or primary care physician deals with this, and then these are all put into the algorithm, and after they are introduced into the algorithm, autism positive or autism negative, or it is named as an expert view is required. practitioners and the pediatricians for referral to the pediatrician. This may be a good application. And ADHD is a common neurodevelopmental disorder in children and adolescents characterized by inattention, hyperactivity, and impulsivity. It also affects not the individual as well as the parents, and traditional treatment includes a medication and cognitive behavior therapy. Both have limitations, and new technologies such as virtual reality, augmented reality are started to be used in this. And what is this virtual reality, augmented reality, and mixed reality? In virtual reality, it is fully immersive, computer-generated environment. User wears a VR headset and sees only the virtual world. And in the augmented reality, overlays digital elements onto the real world. And in mixed reality is the real and virtual worlds, enabling interaction with both. These tools are being explored to enhance ADHD diagnosis and treatment. And with the interaction it provides, because of the sense of reality, AR and VR are also used in certain mental health fields, and the most of these use VR, especially in the field of ADHD. And the virtual, we know that the virtual reality performance test becomes prominent, and and VR CPT is the most widely used non-traditional tool for ADHD diagnosis and management, and it assesses ADHD symptoms, improves the diagnosis process, manage ADHD symptoms, and improve concentration, academic skills, and memory. And it can be easily observed, the reactions by the child. And also one of the therapeutic tools is AI-supported therapeutic tools, and this is Jetu Stimule. It is developed especially for children with ASD, enhance social interaction and communication skills, use multisensory stimuli through gamified environments and personalized content based on the child's developmental level. And there are focus areas: emotion recognition, social storytelling, attention enhancement. As you see, there are the faces of the children down at the bottom. And also there are AI-supported therapeutic tools, for example, virtual reality assisted therapies, AI-enhanced VR exposure therapy for phobias, social anxiety, or PTSD in youth, and create safe, controlled, immersive environments for the therapeutic learning. Engagement is higher in digital native adolescents. And AI-supported therapeutic tools, AI-driven applications deliver cognitive behavioral therapy using chatbots trained on evidence-based techniques, and these applications provide immediate emotional support and psychoeducation through natural language conversations, especially helpful for youth with mild to moderate anxiety and depression. And it may observe the mood of the users, and also the content may be personalized, and also the therapy may be individualized. And also there is an application, especially in youngsters, in order to decrease self-harm in adolescents and suicidal intentions. And we see that there are coping strategies, and it tracks emotional states and urges over time, and clinically used as an adjunct to therapy between sessions. It is confidential though, and it also provides support to the parents as well. Autism spectrum disorder, ADHD, anxiety. Later to this, it provides simple and fundamental information. And during the crisis, how the tantrum or aggression tantrums, how would be managed, and it includes the psychotherapeutic contents. It is accessible 24/7 days. And then as a result, clinical decisions support systems, and it does not only provides the data, it also interprets, also refers, and the clinical decision systems supported by AI. It provides information about to the physicians about the possible risk, and it works with the integrated way with electronical registries. So artificial intelligence is not a distant future. It is already transforming child psychiatry from earlier diagnosis to personalized interventions and smarter decision-making tools. And thank you very much for your listening.